Hi, I'm Dr. Tim Sproule. I want to talk to you now about carpal tunnel syndrome and the potential treatment options you have available for it. Carpal tunnel syndrome has become a quite common condition over the last number of years, probably related to our excessive use of computer keyboards. It basically is a condition that causes pressure on the nerve of the central part of the wrist, called the median nerve. The pressure is caused by a combination of uh, a, uh, a bit of swelling of the tendons, or a bit of disruption or misposition of the bones of the wrist, which can result in you having a smaller space, and those other structures, if they become swollen or the overall space becomes smaller, will press on the nerve, and that will impair the conduction of the nerve so that you have a loss of sensation, usually in the first three fingers of the hand and half of the ring finger. You also lose some of the muscle power to the what's called the thenar eminence at the base of the thumb, and so you can get some weakness. The treatment options for this condition, if you have it, are first of all to try splinting or try changing your occupation so that you're no longer doing whatever it was doing was causing you the problem. Repetitive work of the same type is often associated with this. It's also associated with pregnancy, where you tend to get a bit of fluid retention, and other conditions that give you fluid retention that will cause the tendons to swell and then thereby press on the nerve. After considering conservative treatment with splinting or changing your exercise or physical activity routine, the next thing to consider is surgery, really. Surgery is quite effective in correcting the problem. And the way the surgery works is we basically go in and cut the carpal ligament. That's a thick ligament that lies at the top of the tunnel, you could say, with the bones of the wrist being underneath. That ligament is cut. It then springs apart and heals together with some scar tissue, so the actual carpal tunnel itself is a little bigger than it was. And then, even though your tendons may be a bit swollen, the nerve is much freer, and so you have less problems with it, getting difficulties with the conduction of the nerve impulses. This surgery can be done very easily under local anesthetic, and usually only takes about 10 minutes to do. There's obviously a risk of the surgery of injuring the nerve itself, which can happen rarely. And in particular, there's some small extra branches off of the nerve that sometimes can be injured, in particular the motor branch, which supplies the muscles at the base of the thumb. And if those muscles are not functioning normally, you'll have a permanent slight weakness of the hand. This surgery is done very routinely, very commonly, and I think it's one of the better operations we do if you have the significant symptoms. What are the symptoms? Numbness, which tends to happen while you're driving or when you're doing work, sometimes continuously, and in particular at night. And you can also get pain with the condition, in particular also at night. So that's about all I can tell you about carpal tunnel syndrome. I think if you have the condition, you should have your physician organize first an investigation using a technology called an EMG, and following that, consider a consultation to a hand surgeon.